Good morning and welcome back to day 2 coverage of the World Healthcare Congress here in Washington, D.C. I'm so pleased right now to have Sean Hogan in the studio. He is General Manager of Healthcare and Life Sciences at IBM. Good morning, Sean.
Great to be here, Mabel.
Great to see you. Well, your work in the healthcare space is long. I mean, you have a lot of initiatives, new initiatives happening,
Yes.
but you've also been in this area for a long time. Give me a brief overview.
Sure. Well, let me just first start with why we're here. It is, and take the moment of time that we're in the middle of right now. Everyone who comes to this event, and we've been participating in this event over a series of years, is motivated and driven by how our health systems better serve their populations. That's what we're about, giving better health, better access, better quality of care to the people that we serve. And there's been this dialogue about how do we make our systems of care, all that we invest in healthcare on behalf of our societies, all the incredible advancements that we've made in medicine and technology to deliver better outcomes and be more effective. And we are now seeing an incredible transformation play out in this industry. And we have been such a important advocate and sponsor in it from multiple dimensions. So IBM, because we're a large employer, we have hundreds of thousands of people for whom we provide care, and we invest $2 billion a year. And we really think about it as an investment that we make in supporting our people. We've also been part of this dialogue of how do we help drive a constructive dialogue about how we can make changes in the way our health system operates to deliver to those aspirations that we all have in terms of the healthcare systems. And then we have an incredible set of capabilities that we can bring forward solutions to help these organizations. And that is, I think, what's so exciting to us now is that because of the changes that are taking place in healthcare and because of the kinds of things that we can do and what we can bring from our experiences in other industries, we're really having an incredibly exciting opportunity working with all kinds of organizations to help drive the mission and visions that they have to support care providers who are trying to deliver better care to patients, to help patients better be able to address their situation or be better engaged in their care.
Absolutely, and you're actively seeking out partnerships, creating new initiatives, and launching new units. Well, actually, we are at a year anniversary, I believe, of the opening of the affiliate of Watson Health in Cambridge.
Yes, exactly.
Where are we at a year ahead now, or a year past?
So you teed it up exactly the right way, which is we're doing all kinds of partnerships. And that's been an amazing and important part of how we're coming at this. We recognize that to take on a challenge as great as health, that's not going to be something that we on our own. And IBM has a wonderful track record of taking on huge challenges and making amazing contributions. In fact, that's the kind of thing that just motivates the people in our company. That's why we attract the people that we attract. And those are the kinds of things that we like to stand for. But we know in this case, it's going to be about partnerships. So when we announce the formation, so this is first a very big and important commitment across all of IBM, the work that we're doing in health. And it was exactly a year ago that we did something we've never done before as a company, is create an entire new organization to focus on this opportunity and helping bring all the wealth of what IBM has to offer to it. And over the course of the year, and we made some announcements today that we might talk about, we have been working in collaboration with other organizations to change the way people experience care, to exchange the way care providers offer care, to the way even countries, nations, regions provide support and resources to their communities, to their populations.
Yes, and today at the conference, you did announce a partnership with the American Cancer Society.
We did.
What do you hope to achieve there?
Sure. Well, what an amazing institution, right? And that's embodies, right?
Yes.
It's 103 years old, I think, and they have been all about supporting people who have cancer. And they, as Gary, the CEO of American Cancer Society, shared today, 1.6 million people receive a cancer diagnosis every year. And they're finding that people are turning to them for support and advice. And one of the things that we're doing, and this is where the power of cognitive computing is so compelling and important, is we can tap into the incredible wealth of knowledge that they've accumulated with the 100 years of their history, as well as all the organizations that they work with to support the patients, to support the caregivers who are supporting them, and then also survivors. And that's a really exciting part of their journey too, is more and more American Cancer Society is supporting survivors, which in and of itself is a great story.
Well, together you're creating a virtual cancer advisor?
Yes.
What is that?
So when people get a diagnosis, they are going online and they're going to sources that they trust to learn more about their circumstance and their condition. And so where the cognitive computing comes into place, we have been feeding the information to the power of the cognitive computing, and it is designed to learn and take advantage of that information. And then it can support an interaction with an individual to help give them the kind of content that they would need to help understand their condition, understand their options, guide them on life choices that they might make, all oriented to help them better deal with their condition and have a better understanding of their choices and what they can do to be a proactive participant in their predicament.
And what about the formation of a IBM Health Core? I'm curious.
Yes,
that sounds really cool.
Yeah, well, that's been another great tradition of IBM, is to have this notion that we are a corporate citizen in all of our communities, and IBM employees are distributed all over the world. So we formed a service corps modeled after the Peace Corps that was started in the 60s, right? And we see our employees as an extension into communities. And so with this topic of health being such an important topic for IBM overall, we're taking this program and driving it into the way that we work with communities around the world in support of their healthcare challenges. So we have some experience working with some regions in Africa, and what we're taking on there is getting a better understanding of the information about their populations and how we can help them. In UK, there's a program that we've been involved targeting obesity, and we can pull in all of the field notes from the people that had been, from the caregivers and social workers that had worked with the people who have had obesity, and when there are incidences of mortality, and start to look for the patterns. And this ties back to what are we, collectively, what are we doing in this whole area of healthcare? And we see an opportunity to reinvent the notion of discovery. And so so this Peace Corps, or the Health Corps, is an example of places where we're now, through the active work that we're doing in the field and all of this information that's available, using it to derive new kinds of insights about the conditions or problems or treatment approaches. So new sources of discovery. And we're seeing a lot of interest out of the pharmaceutical companies in exactly that kind of information, because that supports their perspective on, or what they understand about how people interact with their drugs, how they adhere to their treatment program, and then how that may translate into a change in outcome with all of the many complicating factors that we deal with in the real world of multiple conditions and environmental factors and our physiological information. So that's one big area that we're involved in, is that notion of discovery. The other is how we think about the way to reimagine care delivery. So how does care get provided? And in that realm, we're doing the kind of work that you've heard us talk about in oncology. And in that domain, we're helping. And this is a part two of the story that I think is so interesting to us, is what's drawing us into this area is that the caregivers, the physicians, they are so hungry for technology that helps them. Today they're overwhelmed with information. And I think in many cases, I think they're finding they're working more for the technology than the technology working for them. They're also telling us that the patients will demand this kind of, because when you show up, when you're having a trusted conversation with your caregiver, you want to know that they have access to all of the information that may be pertinent to your condition. And then another area where we're really getting to the how and what we're doing is in how we think about our collective notion of wellness, what our well-being is driven by. And that's where the comments that earlier today made by the CEO of American Cancer Society was talking about. In 50% of cases of cancer, it's driven by, or I'm sorry, your lifestyle choices can have as much as a 50% impact on how disease progresses with you. And so we're just starting to learn all of those different things that relate to the environment, that relate to are we a smoker or not, what are our eating habits, our physical activity, and if we can better understand those, and if we know the risks that an individual may have because of their historic or family makeup or genetic background, then we can inform a caregiver in an interaction that helps guide a person in their habits and choices to get to a best outcome for their personal situation.
Okay, well, Sean, certainly a lot of exciting things happening at IBM. Thank you so much for sharing some of them with us today.
It has really been a delight talking to you today.
And I'm Mabel Jong. Thanks for watching.